So today, we're diving into a really critical condition, one that operates deep inside the body. We're talking about a silent but incredibly deadly buildup of pressure that can literally turn the body against itself.
I mean, it's a terrifying thought, right? Our bodies are constantly working to keep everything in this perfect, delicate balance. But what happens when that balance gets completely shattered, not from the outside, but from a pressure crisis building from within?
And that's exactly what we're talking about today, a condition where that internal pressure hits a breaking point, a really, really dangerous one. Okay, so what in the world is abdominal compartment syndrome, or ACS? Well, think of it as a two-punch problem. First, the pressure inside your abdomen just skyrockets. And second, this is the really critical part, that pressure gets so high it starts to choke off the blood supply to your vital organs. They're literally being squeezed until they start to fail. Honestly, the best way to wrap your head around this is to picture a pressure cooker. As fluid or swelling or even blood starts to fill up the abdominal cavity, that pressure just builds and builds and builds. But here's the scary part. Unlike a cooker, there's no safety valve. That pressure has absolutely nowhere to go. And the stakes here, they could not be higher. The source material puts it bluntly, this can lead to multiple system failure and death if not promptly recognized and treated. You know, when organs like the kidneys and lungs are starved of blood, a catastrophic domino effect begins. The clock is ticking from the moment this process starts. So you're probably wondering, what on earth could cause such a dangerous pressure spike inside the body in the first place? Yeah, so ACS isn't something that just pops up out of nowhere. It's almost always a terrible complication of some other severe medical event. The triggers usually fall into a few main categories. You've got massive fluid buildup, severe internal swelling from things like pancreatitis or major burns, or even things like internal bleeding. All these different roads can lead to the same dangerous destination. So when you look at that list, you start to see a pattern. The people most at risk are the ones who are already in an ICU, fighting for their lives. Patients who suffered massive trauma, extensive burns, or just had major abdominal surgery, they are by far the most vulnerable. Their bodies are already under so much stress, which just makes them susceptible to this kind of crisis. Okay, but think about this for a second. This creates a huge problem for doctors. If your patient is already critically ill, with all sorts of alarms going off, how do you spot this one specific hidden threat among all the other chaos? Well, clinicians are on the lookout for a few key things. The most obvious sign is a rock-hard, swollen belly. That internal pressure is also pushing up on the diaphragm, which makes it incredibly difficult for the patient to breathe, even if they're on a ventilator. Then, as the kidneys get squeezed and lose their blood flow, urine output just plummets. And finally, you see signs of shock. Blood pressure drops and their arms and legs get cool to the touch. But here's the catch. So many of those symptoms could be caused by other problems you see all the time in ICU patients. Is the low urine output from ACS? Or is it a separate kidney injury? Is the breathing trouble from the pressure? Or could it be pneumonia? To know for sure, doctors can't just rely on what they see. They need a concrete measurement. They need a number. And this is the number that cuts through all that noise. Doctors can actually measure the internal pressure directly, usually with a catheter that's placed in the bladder. Now, a normal pressure is pretty low, less than 12 millimeters of mercury. But once that number climbs past 20, that is the definitive, undeniable sign of abdominal compartment syndrome. It confirms the diagnosis and signals that it's time for immediate, drastic action. All right, so they have the number. The diagnosis is confirmed. Now what? How do medical teams fight back against this internal crisis? The response has to be fast, and it has to be decisive. Well, the intervention is kind of like a step-by-step escalation. First, they focus on supportive care, managing the ventilator, trying to keep blood pressure up, anything to keep the organs going. If the problem is a ton of fluid, they can try to drain it with needles. But if those things don't work and the pressure stays dangerously high, there is only one definitive solution left: surgery. And this definitive treatment, a procedure called a decompressive laparotomy, it is incredibly dramatic. The source material has this striking description of one method. The sterile saline bag was sewn to the skin edges to cover the abdominal wall. Just think about that for a second. Surgeons make a large incision and literally open the abdomen up, immediately releasing all of that dangerous pressure.
And the whole idea here is actually pretty simple, even if it sounds extreme. The abdomen is left open on purpose.
It's covered, of course, sometimes with a sterile bag or a special vacuum device, but it's all designed to give the swollen organs room to breathe, so to speak. This is what stops the pressure from just building right back up, and it gives the body critical time to heal before they can even think about closing the abdomen again, which could be days or even weeks later. So as you can see, every single part of this, from the first warning sign to the final surgery, it's just this desperate race against a deadly clock. And this next number, well, it shows you exactly why that race is so critical. Even with the absolute best care, with the most aggressive treatments available, the mortality rate for patients who get abdominal compartment syndrome is shockingly high, over 40%. It is truly one of the deadliest complications a critically ill patient can face. So when you boil it all down, what's the one thing that matters most? The single biggest takeaway is this: survival depends on speed. The ability to recognize those warning signs early and to take bold, decisive action, that's often the only thing standing between the patient and total organ failure. And that really leaves us with this one big question, doesn't it? Abdominal compartment syndrome is just such a powerful, humbling reminder of how fragile our internal balance really is. It forces us to ask something that's at the very heart of medicine. In the middle of all the chaos of critical illness, when every second counts, how do we get better at hearing the body's most urgent, and often its most silent, alarms, before it's too late?